Hey guys, another day, another vlog. This is the calm before the storm I feel. I woke up about 8 minutes ago. I have 2 back-to-back appointments this morning and it's gonna be a rush to get them both in. One of them is out of the house. So yeah, it's gonna be a busy morning. Just got home from the school run. My first appointment is in about half an hour. So the first appointment is with Avery's portage worker and it's a video call. She would normally come to the house but she's hurt her leg and she can't drive, so she hasn't actually been able to come out for a home appointment for about a month or so now. That's at 9:30 and those appointments usually last about an hour. What's wrong, Pudding? Hey? What's the matter, Pudding? Are you tired? Hey, are you tired? We've got a busy morning. Oh, that's better. That's better. So yeah, those appointments usually last about an hour, but ideally I need to be out of the house by 10:30 to get to my next appointment. It's not very far, so I am going to drive to it, so I need to get the car ready, put the iPad in there with Frozen on and stuff for Avery and get all of her stuff together. Honestly, it's like a tactical mission every time we need to leave the house. Sometime between now and we leave, Avery also needs to have her snack as well, so it's going to be tight, but I think we'll manage it, won't we? Are you going to be good in the car? You're not going to scare mummy? No? Yes? Hiya, you're right. Oh, I'm not sure. I'm not even sure where things were when we last spoke. Yeah, so, did I tell you about us being in and out of hospital for about a week? Yeah, so she got better, the antibiotics worked, but then she started to get poorly again with like some kind of viral infection. It was a bad idea to drive to that appointment. Me and my husband talked about it, and because the distance wasn't that much further than when we go to stay and play, we thought we'd try and push the boundaries a little bit, see how Avery coped. It would be fine, it wasn't that far. We were wrong. On the way there, it was okay. It wasn't too bad. She whinged a little bit, but I knew she was okay and she was safe. But I think on the way back, because we'd already been out of the car, she'd already gotten frustrated of being out of the house and being in the pushchair. On the way home, she started to scream, and it's like no scream she normally does. I mean, you can see she's gotten herself into a sweaty, foamy mess. It's heartbreaking and it's terrifying. I had to stop twice, bearing in mind this is a 5 to 10 minute journey. Sorry if the camera is shaking, it's because I'm trying to bounce Avery into calm again. But yeah, I had to stop twice just to get her out of the car, to calm her down enough to put her back in the car seat. But the second we started driving again, she just screamed. I'll be honest, there was a couple of times when I thought she was going to send herself into a seizure. And this is why we're housebound, pretty much. I just hope that experience doesn't impact her for short journeys like stay and play, because if it has and she starts doing that on those short journeys, then we're not going anywhere. I'm gonna get this little lady some food now, try and make her happy again, and I imagine that car journey has tired her out quite a bit, so I'll see if she needs a nap. She is calming down a bit now, but that wasn't a nice experience. I know it looks like I haven't moved since the last clip, since I'm in exactly the same spot, but I promise you I have. Avery has had some food, and every time I put her down, she screams like she did in the car. So I don't know if she's just feeling a bit worked up or what. I just really hope I've not traumatized her. But yeah, it looks as though this is where we're going to be staying until it's time for the school run, and I'm a little bit nervous about that now. I managed to get Avery down for a nap. That whole ordeal has really worn her out. It's worn me out too, to be honest. So I did a little bit of shopping while I was out. Looking back now, I wish I had just gone to the appointment and gone straight home, and then maybe I could have avoided Avery getting so worked up. But at least now I know that was too long of a distance. I mean, it was 10 minutes, maybe a 10-minute car journey, but it's just too long to go out with Avery in the car without somebody supervising her in the back. So yeah, at least now I know. But anyway, I bought a few little bits. Now I know there's going to be a lot of you that are probably going to be swearing at me, but we are starting to prep for Christmas. With the prices of everything going up massively this year, we just thought it was smart to try and buy a little bit each month, so that we're not scrambling in November, December time, because everything's just so expensive at the moment. But anyway, so I picked up some chocolate coins for the boys. I like to do a little Christmas Eve box for them, so that is probably what they will be for. I picked up this hair mask treatment. It was only £1, and the reason why I feel like I really need this at the moment, I don't know what is causing it, but I am losing an awful lot of hair. I don't know if it's some kind of delayed postpartum thing, or if it's stress, or just age. I'm gonna be 30 next year, so maybe it's that, but I'm losing a lot more hair than I usually do, so I guess I'm thinning. I am lucky that I have really thick hair anyway, so I do have some to lose, but I want it to stop now. My scalp has also been really dry and flaky for as long as I can remember now, probably since I was pregnant with Avery, and it's just not gone away, so that could potentially be why my hair is falling out as well. But anyway, I just feel like I need to take a few extra steps to try and take care of my hair a little bit, because obviously I do bleach my hair, which isn't great for it, but I like it blonde. So bought a hair mask to see if it will help. I also popped into Boots and I grabbed a new toner because I'm nearly out of the one I've got. They didn't have the one that I normally like. The one I like is from Botanics, but this is the L'Oreal Paris Fine Flowers toner, and it seemed as though it was gentle. I just want something gentle to kind of use after my cleanser. And I have used something with rose in it before and my skin didn't react to it. So this is rose and jasmine for dry and sensitive skin. So I thought I would give that a go. I also picked up my favorite cleanser. This is the CeraVe Smoothing Cleanser with salicylic acid. I talked about this in my skincare routine in my vlog a few weeks ago. I really love it. My skin has cleared up really well since I've been using this, and I have been using this for well over a year now, so I don't think I'll be changing anytime soon. And I also bought some travel minis, and I will explain more about this in future videos. But I bought a conditioner. This is the Sheer Blonde Moisturizing Conditioner. Again, I went for something that was moisturizing for blonde hair because of my hair falling out. I already have a travel sized silver shampoo, so I didn't need to get shampoo. I also bought a mini heat protector spray, again just trying to be good to my hair at the moment, and then a dry shampoo because I don't wash my hair every day. As a matter of fact, I don't wash my hair every other day. I probably wash my hair once to twice a week. I just feel like I don't have any more time than that, and apparently it isn't good for your hair to keep washing it anyway. It strips it of its natural moisture, so yeah. Dry shampoo is my best friend. Anyway, I'm not too sure what the rest of the day is gonna look like, whether Avery's gonna wake up in that same mood, which probably means I'll just have to be cuddling her all day, but I am exhausted after that, so I'm probably going to carry on filming tomorrow. So for you guys it will literally be a split second, but for me, I will see you guys tomorrow. Told you it would only be a split second. Morning guys, it is the next day. Avery and I have just been doing some tummy time on the ball, haven't we? Yeah. I've actually really grown to like that ball for tummy time. She seems to do really well on it, so I'm making a bit of a goal for myself to get her on that ball at least once a day to really try and strengthen the muscles in her neck. So after I left you guys yesterday, I did the school run and Avery screamed in the pushchair. It actually got to the point where just before we left the school, I had to take her out of the pushchair and carry her home. I mean, that really made Zach happy because it meant he got to push the pushchair, and he really loves doing that. I think the trip in the car yesterday traumatized her, and that makes me feel so incredibly guilty for even trying to take her out in the car in the first place. But I think it was needed just to kind of confirm that Avery really does need somebody keeping her distracted. But anyway, I was a bit worried that I had completely traumatized her to the point where we were going to go back to a year and a bit ago where we couldn't even put her in a pushchair or put her down. But luckily the school run this morning, she was fine in the pushchair, so I think it just got her really worked up yesterday. Are you talking to me? Are you trying to get my attention, or are you telling me to put Frozen back on? Frozen. It's Frozen, is it? So yeah, yesterday was hard. It was really, really difficult. She spent the rest of the day quite fussy. She didn't want to be put down. I think she's telling me that she wants Frozen back on. That's the washing put away. I swear it's like a never-ending cycle of washing in this house. I think I get like one day a week where I don't have any washing to do. It's just never ending. I know I said in a video a few weeks ago that at some point I was going to give you guys an update on Avery's kind of brain injury and where she's at in terms of neurology on the medical side of things. And I was waiting for her neurology appointment, which was supposed to be on the 16th of September. We'd been waiting a year for it. At the last appointment, which was last September, the neurologist said he would review in 4 months, and it turned out to be an entire year. Well, I had a phone call from one of Avery's community nurses who said that it would probably be a wasted appointment since the community paediatrician already put Avery on baclofen and she wouldn't have been on it for that long by the appointment, so the neurologist probably wouldn't have done anything different. So we decided to postpone the appointment until the following month, so October. I haven't heard about another appointment yet. I don't have a date for one, so I am just keeping my fingers crossed that Avery is in the clinic for October. If she's not, I will be a little bit frustrated. But we've been waiting for this appointment for so long now. Avery really needs to get into the complex movement disorder clinic, and a lot of Avery's challenges and struggles are on the neurology side of things, such as her cerebral palsy, her tone, and her dystonia. So we really need to speak to the neurologist and just try and come up with a solution. And that actually leads me perfectly onto something that I really wanted to talk about. I just realised that this entire video, my camera was on zoom. I was wondering why I couldn't keep my camera far enough away from my face, but that is why. That's better. Anyway, when Avery was first admitted to hospital after her cardiac arrest, I was really at the mercy of the doctor's knowledge, I suppose. At the time, I didn't know anything about cerebral palsy. I'd heard of it, but I had no idea what it was. I didn't know much about neurological disorders. I didn't know much about seizures. I didn't know anything about dystonia. I'd never even heard of it. And I didn't know a whole lot about brain injuries in infants. I did have a little bit of background knowledge in brain injuries in adults and how that can affect someone, so I did know just how much the brain can affect everything. But in terms of Avery in particular, I just had no idea what to expect. And in the same sense, as much as I hate to admit it, at that point I didn't really know a whole lot about Avery. I mean, she was only 3 days old when she went into her cardiac arrest. That wasn't really enough time to really get to know the kind of things that she did, what was normal for her, what wasn't normal. So we really were just at the mercy of the doctors and what they knew, what they could tell us, and what they could find out. I have a lot of respect for doctors and the knowledge they have, the things they've learnt. I mean, obviously they go to school for a very long time to learn what they know. However, something I have realised over the last 6 to 12 months, I would say, is that as a parent carer, you definitely have an advantage over doctors when it comes to your child, and that is you know your child better than anyone else. Doctors may know way more than me about cerebral palsy on a wide scale and how it can typically affect children and the spectrum and where children can lie on the spectrum, etc, etc. But they have a lot of patience. They see a lot of different people. When you're a parent slash carer, you know your child. You know exactly how cerebral palsy is affecting your child, and you know what's normal, what's not normal. And consultants, which Avery has a lot of, usually have a particular area of knowledge, something that they've studied more than other things. So I could potentially go to a respiratory specialist with Avery, and that respiratory specialist may know nothing about a lot of Avery's neurological disorders because that's not her field, which means I've actually got a lot more knowledge about that than she does or he does, purely because I've learnt that through caring for my child. And I think that learning that over the last few months and just knowing that has really helped me with my confidence when it comes to doctors. When Avery was younger and we used to go to appointments, I used to get so nervous in these appointments. I was worried that they were going to judge me. I was worried I wasn't going to understand what they were saying. And I was worried that Avery wasn't going to get the best treatment or outcome because I didn't know what I was talking about and I couldn't communicate what I thought she needed well enough. But now I've learned that in these appointments, every little thing about Avery is important. So those little things that you think aren't worth mentioning because, oh, it's probably normal, otherwise the doctor would have said something, it may not be. So I will bring up every single thing that is going on with Avery because it could potentially be interlinking with something else. And then in that way, what I learn about Avery and the things that I know about Avery can be paired with the knowledge that the doctors have to essentially provide a better care package for Avery. So for example, since we've had the issue with the car in this vlog, I'm going to take you back to when it all started. When Avery was around 3 months old, she used to get incredibly distressed in the car, even with me sat in the back with her. She used to make these funny movements, she used to scream, she used to get very distressed, she used to breath hold. It was very similar to what she did in the car yesterday, but we were absolutely convinced that she was having seizures because she had had seizures in the ICU, and we knew because of her brain injury that she was always going to be susceptible to having more. So we ended up calling an ambulance, and Avery got taken to urgent care at the nearest hospital to us at the time, which was actually in Plymouth. So it wasn't our local hospital where all of our consultants were that knew Avery and were used to Avery. It was a completely different hospital, and they did not have her file on their database. Apparently a lot of hospitals don't actually interlink their databases, so we could go to a different hospital and they may not know anything about Avery, which means it's our job then as Avery's parents to explain her needs, her conditions, and what medicine she's on, etc, etc. So the doctors in urgent care were also quite convinced that she was having seizures. I remember asking the doctor that was in the emergency department, is she having seizures? And he just looked at me and nodded. They gave her a form of diazepam and it immediately calmed her down, and she was then admitted to the high dependency unit for 3 days while they investigated. She had a detailed EEG which went over a few hours, and she did continue to have some of these funny movements within that EEG, but from the results they weren't actually considered epileptic or seizures in nature. So we went away from that hospital not knowing what these movements were at all. Now we know exactly what those movements are. Those movements are her dystonia, and dystonia is a movement disorder. Before she was 3 months old, before she got admitted into the hospital in Plymouth, we had actually taken her into our local hospital to ask about these movements, and her paediatrician had said that she thought they were reflux related because there was a lot of back arching. The word dystonia was mentioned then, but it was said to us that she didn't think that it was dystonia because it didn't have the typical pattern. I wasn't totally convinced that it was reflux. I had said all along, I do not think this is just reflux. And then lo and behold, when Avery was 6 months old and she had her first neurology appointment, she was diagnosed with dystonia. So all along, those movements were not reflux, they were not seizures, they were dystonia. And by the time she had the neurology appointment, we had figured that out. We knew that the movements were most likely some kind of movement disorder. So essentially, what we thought was actually right, because we knew Avery more than the paediatrician did as a baby and as a person, and we got to spend a whole lot more time with her than, you know, a 20-minute appointment. What we thought was right over what she had diagnosed. So that just goes to show that sometimes doctors can't really get an entire picture of your child based off of these short appointments. You really do have to go in there and fill in the gaps on what your everyday life is like and what they are like as a child, as a person. Now, I am in no way discrediting doctors at all. Like I said, I have so much respect for them. I think they do an amazing job, and I think they know a whole lot about a whole lot, but they don't know as much as you do about your child. That is what I'm trying to say. They may know more about the medical side of things, but not about your child as a whole picture. So when I go into doctor's appointments now, I kind of go in knowing exactly what I want to talk about, exactly what my concerns are, exactly what I think is bothering Avery. I will suggest medicines, I will suggest things that I've done research on myself, and then I will trust that the doctors will be able to tell me whether it's a good idea, if there's any risks, so on and so forth. And ultimately, a doctor won't prescribe or advise a treatment or therapy if there's a reason why your child shouldn't be doing it. One of you guys actually told me about marshmallow root for reflux because traditional medicines aren't helping Avery whatsoever. So I actually spoke to Avery's community nurse about it, and she'd never heard of it, but she is now going to go away. She's going to speak to Avery's consultant and make sure it's not going to interfere with any of her other medications. If not, then we are free to try it for Avery, and if it works, then that's amazing. But obviously I always consult with Avery's medical professionals because sometimes things don't go well together, or sometimes there might be a risk to Avery for doing something. We went into Avery's community paediatrician appointment knowing that we really wanted to give baclofen a go. Now, at the time she recommended clonidine, and I'm pretty sure that the neurologist would have recommended clonidine as well, but we'd heard of baclofen, we had done our own research on it, and we wanted to try it. So at that point, the paediatrician explained to me the risks of it, what it can help with, what it doesn't usually help with. She could give me an overall picture picture, but obviously she can't tell me how it's going to affect Avery because we've not tried it. So we're now trialing it, and then we will go back to her neurologist when we get the appointment and talk to him about how we think it's affecting Avery, because how is he going to know? He's not with her all the time, so we need to fill in those gaps for him so that he gets a clearer picture to better treat Avery, if that makes sense. Anyway, that was a total ramble. I'm sorry if a lot of it didn't make sense. I usually write notes when I want to talk about something specific, but I don't have any notes in front of me, so I feel like some of that might not have made sense. But that is a point that I just really wanted to get across, because as a parent carer, or even as a parent in general, especially if you have a young child that doesn't really communicate their needs yet, you are your child's advocate, you are their voice, and it is so important that you get their needs across and that you explain what you think is best for them. Doctors will always advise you on the risks, but ultimately you know your child better than anyone else. So now that I've talked your ear off for God knows how long, I'm gonna get Avery's snack ready, and then I'm gonna head down to the doctor's because I ordered her some more syringes. So hopefully they are ready because we are nearly out. Avery's just gone down for a sleep, so I think I'm going to close this vlog off here. I hope you enjoyed it. If you did, then please give it a thumbs up and hit the subscribe button to follow us along on our journey, and I will see you all in a few days with another video. Bye guys.